Caesarean section, the most popular procedure performed nowadays in obstetrics. The origin of the name Caesarean section is quite debated. Some believe Julius Caesar, an ancient Roman emperor, was himself born by Caesarean section. But some say Caesarean section was done during his rule on dead mother to save the life of the baby. Whatever the reason was, but now with improved techniques, it has become the most popular procedure in obstetrics for the safety of mom or baby. Still, it can never replace the natural way of giving birth, that is normal vaginal delivery. Natural way of giving birth has its own benefits for you and your baby. You have a shorter stay at hospital, quicker recovery, and avoid the risks of having major surgery. Your baby, while passing through the birth canal, takes in some bacteria, which helps in building stronger immunity. Baby is also able to clear the fluid from lungs while passing through the birth canal, and this prevents him from having transient tachypnea of newborn. Immediate skin to skin and breastfeeding within the first hour of life is possible with vaginal delivery, but becomes difficult with Caesarean section. Still, in some situations, vaginal birth is not a safer option for you or your baby, and your obstetrician might recommend an emergency or an elective section for you in conditions like breech presentation, that is baby lying bottom first, placenta previa, that is placenta lying on the neck of the womb, fetal compromise, prolonged first stage of labor, fetal distress in labor, second stage Caesarean section. The list is not limited to only these conditions. If you go for emergency Caesarean section, there might not be much time to plan in advance. But if you go for planned Caesarean section, then you have time to plan things ahead. For elective or planned Caesarean section, you will be given the date for Caesarean section. Following that, you might have a pre-operative appointment with the anesthetist. You will provide a blood sample to check your hemoglobin and to make sure you don't have anemia. Your blood group will also be checked. You will be given medication to take home with. These include anti-sickness or anti-acid medication. You will have to take it one night before the surgery and on the day of surgery as well. You will also meet your doctor, who will explain you all about the procedure and risks associated with it. You will need to sign the consent form in which all the risks of surgery will be written. Certain things you can do a day before a Caesarean section are: try to stay calm and relax. It's easier said than done. Think about that you will be meeting your baby soon. Have a high carbohydrate meal one night before surgery. Depending on the time your surgery is planned, you will need to keep fasting. You can eat and drink in your normal routine a day before your surgery. You should take anti-acid tablets one night before and one in the morning. This reduces the amount of acid in your stomach and helps from surgery and anesthetic point of view as well. To prevent wound infection on your skin after surgery, shave your pubic hair few days before surgery. Have a bath before coming to hospital and clean the area with soap and water. Do not use any creams or lotions on your tummy. On the day of surgery, you will be called as per the time scheduled for your section. You will be seen by a doctor, midwife, and an anesthetist. You can ask them any questions at that point of time. The midwife or the doctor will listen to your baby's heartbeat. Stockings will be given to you to prevent the clot in the legs. Some swabs might be taken to rule out any infection. You will be taken to theatre at per the scheduled time. IV cannula will be inserted, fluids and antibiotics will be given. In theatre, needle in your back will be given, which is called a spinal anesthesia, which will numb the lower area. A catheter or a plastic tube will be inserted in the bladder to empty the urine. The operation will be started. 10 cm horizontal cut is made around the bikini line. After opening the abdomen, a small nick will be given on the uterus to deliver out the baby. Once the baby is delivered and is healthy and crying, the obstetrician might consider delayed cord clamping for 2 minutes. This will help extra blood to go in baby from placenta. This is beneficial for the baby as it improves iron in the baby, which will also help in brain development. The baby's well-being and initial assessment will be done by the pediatrician or midwife. After taking the placenta, everything will be checked inside and then an obstetrician can stitch back your uterus followed by abdomen and skin. Skin will be sutured with absorbable stitches and these stitches will dissolve on their own later. The whole procedure takes around 40 minutes. After the cesarean section is over, you will be taken to the recovery area where your well-being will be checked. You will be encouraged to breastfeed and have skin-to-skin with your baby. Your well-being will be assessed from time to time and then you will be taken back to the room. If everything is fine, you will be offered a drink or a light food. You will be then encouraged to move around within 24 hours of your operation and your catheter will also be removed sooner rather than later. You will be given painkillers to relieve the pain after the section. Once all is well, you will be discharged home soon. Some hospitals discharge after 24 hours and some may take 2 to 3 days before discharging you. Taking care at home. Your baby will become your priority, but don't ignore your health and take enough rest. Ask for support and help till you recover and your wound heals. It takes around 6 to 8 weeks to come back to normal. You might feel emotionally upset as well at times. Do seek help and talk about it to your near and dear ones. You can also watch our video on postpartum recovery to know more about how to recover soon. You can take paracetamol or ibuprofen when needed. Keep an eye on your bleeding. It is normal to experience bleeding after section, but if the bleeding is excessive and you are changing pads frequently, call your healthcare provider. Your dressing will be removed and your wound will be checked before you are discharged from the hospital. There is no need for dressing afterwards, and your wound can be left open. You need to keep the wound clean and dry. If it starts itching after a week, that means it has started healing. If you see any pus or water coming out of the wound, start developing a fever, contact your healthcare provider. The wound will eventually become a scar and will be barely visible as a thin line near your bikini area.